دكتور.
Okay. طيب. So today we will discuss colorectal cancer. بالسيلبس يعني الأوردر إنه prostate comes after breast وبعدين بيجي colon and lung. I will shuffle them. فرح نعمل colon, colorectal, then we go to the lung and we'll keep prostate to the end يعني just in case for time's sake إن شاء الله إنه بيقضينا الوقت وناخد كمان prostate cancer. colorectal cancer is very important carcinoma and it's really common carcinoma. يعني if I talk about the national statistics in Jordan يعني هو ممكن يكون the most common carcinoma among both gender male and female, okay, with breast cancer being the leading carcinoma in the female. إذا بدنا ناخد gender-based data, colorectal carcinoma is maybe the next most common cancer in females and is the most common in males as well, okay. Colorectal carcinoma, where it happens, okay, it happens to the colon, it happens to the rectum, okay. Sometimes they can come together, يعني at presentation the patient has colon and rectal carcinoma, and sometimes it's separated, only colon involvement or colon carcinoma, only rectal carcinoma, we see these cases, okay. فلما احنا بنقول colorectal cancers we're talking about both, but many cases we see it's really common انه احنا نلاقي colon carcinoma, okay, without rectal involvement. In some cases patients come with only rectal carcinoma. طيب, if I ask you what is the normal physiology of colon, large intestine, يعني ايش ال role, okay, the physiologic role of the large intestine. آية. Yes,
water retention or mineral.
Yes, excellent. So one of the main roles is fluid retention or water retention or control, I would say. Okay, good. What else? Nadine? What else? A very important role.
Absorption.
Of what?
Feel fats.
I can't hear you very well. طيب, غيره يعني a very important role بالGI biology. شو بتعمل ال large intestine أو colon? Yes, Rania?
Waste discharge.
Yes, excellent. إذن elimination of waste, okay? يعني الفيكل material هي عبارة عن waste material, okay? فبالتالي the elimination of the waste material is very important. Well, this is mainly the function of the colon, right? فبالتالي it has to do with the, you know, reabsorption of fluids or control of fluid status, water, very important for the waste elimination from the GI. فإلها very important biologic role. فبالتالي when we talk of the colon, normal anatomy, okay, the colon is divided into parts. ففي عندنا ascending colon, okay, transverse, descending, the sigmoid, this is what we call a sigmoid colon. And finally, we have the rectum here, okay? Colon cancer can actually take place, can happen in any parts. ممكن يكون بالtransverse, ممكن يكون ascending, anywhere, sigmoid colon. It can happen anywhere. Rectal cancer happens in the rectum, okay? هلا, if we compare rectum to colon, okay, rectum by anatomy, by location, it comes a little bit in a lower region in the abdomen. وعادة بيكون عندنا يعني بالrectal area there is a lot of nerve supply, discharge. ف يعني when we talk of rectal cancers, okay, you will notice that Surgery sometimes is not doable, feasible. Why? Because it's hard to remove the rectum without affecting the nerve plexus and the tissue around the rectum. بينما بالcolon cancer, if it is not metastatic, if it did not spread outside the colon, in many cases it is operable, and in metastatic disease sometimes it could be operable, sometimes it's not. فهذا رح نحكي عنه. Okay. ففي فروقات شوي بالمانجمنت between colon carcinoma or cancer of the colon and rectum. We will discuss it a little bit more details, but the anatomy of rectum, the location of rectum is one important thing we have to take into consideration when we treat rectal cancers, isolated rectal cancers with no colon cancer. طيب إذا إحنا حكينا they are important for the normal biology of the GI, fluid retention or control, elimination of fecal material and so on. طيب generally speaking, colon carcinoma is a disease of the elderly. يعني if we talk of the median age in the United States, most of the cases diagnosed around what age? Oh, around 70s. Okay. هلا in national statistics in Jordan, actually the onset is earlier. It's still something we see among the elderly, but median age can be in the late 50s, 60s. يعني still الانسيدنس عنا بتكون a little bit earlier in onset than the United States أو international statistics. فهو بشكل عام a cancer of the elderly, but we do have exceptions where we see colon cancer in the young patient. We will talk when, associated with what. هلا we have risk factors that can increase the risk. احنا ما بنقول انه definitely will cause the disease, but it will increase the average risk. Aging. Okay, يعني أي patient with aging alone, the risk of colon carcinoma is increased. Okay. هلا above 50 years of age, the risk is increased. يعني if I am comparing 50 years of age in risk and 30 years of age in risk, أكيد الريسك above 50 is higher for many reasons رح نحكي عنها. الcolon mucosa يعني إذا إحنا بنعمل colonoscopy, we'll talk about colonoscopy. If we look at the colon, okay. Now, after evacuation, لحتى نعمل colonoscopy, تنظير, okay, large intestine, we have to evacuate, clean the large intestine. فعادة هذا المريض بياخد certain schedule of laxatives, purgatives, so we make sure that the colon is empty and clean. And if we do then colonoscopy, usually this is the normal colon. This is what we see, okay? It's a smooth, shining because of the mucus layer, smooth, ما في عندي abnormal growth or protrusions. Oh, you can see also the blood vessels, okay? So this is the colonoscopy of a normal colon. هلا we have one condition, okay? We call it the polyp disease. هلا الpolyps هي عبارة عن growth, hyperproliferation that starts or come from the colon epithelium, okay? If we see polyps, if we do colonoscopy and we see these protrusions, okay, these يعني extensions, okay, proliferations out of the colon, we call it polyp. Now, the polyp, the existence of polyp is a big risk factor for colon cancer, okay? One very important risk factor is adenomatous polyps. Now, these polyps could be, when they start, they are just hyperproliferating normal epithelium. يعني هي مش هي plastic cells, not cancerous, not malignant. Please mute yourself. فهي not cancerous, not malignant, okay? But because of the hyperproliferation itself, يعني وجود hyperproliferation implies an error or defect or issues with the normal control of growth of the colon epithelium. إذن في مشكلة. يعني الوضع الطبيعي إنه ما يكون فيه polyp at all. Okay. These polyps, the existence of a polyp implies there is a problem with the regular growth of the colon epithelium. فالrisk of these polyps that start as a benign, just normal hyperproliferation of epithelium might transform, okay, might change and become cancerous and so cause colon cancer. فإذا احنا we are doing, for example, regular or routine colonoscopy and we see polyps. طبعا هاي الصورة هون polyps are excessive. Sometimes you don't see as excessive polyp, ممكن يكونوا sporadic, isolated, but they exist. They are there. So the presence of polyps is a big risk factor in these patients, okay, that they might have or develop a colon cancer later on. Some comorbidities have been associated with the risk of colon carcinoma, like diabetes. يعني لقوا إنه many diabetic patients, they are at higher risk of colon cancer. Now, the exact association, why, we still don't know precisely, okay? But most probably it's the hormonal factors that change in patients with diabetes associated with the inflammation that happen that might put the patient at high risk of colon cancer or neoplastic transformation in the colon epithelium. So type 2 DM has been considered as a risk factor. Definitely family history, and this is a very strong risk factor. يعني مثلا إذا في first degree case, even second degree, the risk is increased. Okay. هلا enzymes and transporters are important. هلا because of the normal physiology of the colon is exposed to a lot of xenobiotics, maybe toxic material, additives, coloring agents, preservatives. يعني في بالregular diet تبعنا أو حتى بالregular environmental exposure, we are exposed to many toxic materials. Okay, normally the epithelium is exposed to these toxic materials, but we have defense mechanisms. Okay, a very important defense mechanism is enzymes in the epithelium that will metabolize CYP450 enzymes that will metabolize many of these toxic compounds or xenobiotics, like CYP3A4. Okay, the CYP450 enzymes also exist, okay, in the colonic epithelium. In acetyltransferases, efflux pumps like PK13, for example, they will remove the toxic material from epithelium out. فبالتالي normally the colon is exposed to the toxic material. في كتير دراسات they connect certain diet types to increase the risk of colon cancer because certain diets contain certain molecules, additives ممكن تزيد الريسك of colon carcinoma. Okay, فبالتالي إذا أنا عندي loss of function for these detoxifying or metabolizing enzymes or loss of function to the efflux pumps, okay, the risk that certain dietary factors might imply transformation or become toxic to the colon epithelium is increased, and the risk of colon cancer is eventually increased. Most cases of colon cancer, okay, as we talked before about breast cancer, هي sporadic. شو يعني؟ يعني ما في عنا very specific genes that are known. A very small percentage of the cancers like colon cancer are associated with genetic factor or familial factor. Familial factors means genes, okay? ففي عنا two important genes associated with increased risk of colon cancer, and usually the risk is high. The first gene is FAP, familial adenomatous polyposis. Okay, but بهذا الFAP gene بيكون في عنا autosomal dominant mutation. This is rare. Both of them are rare. Okay, what will result from this mutation? Okay, بصير عندنا an inactivation of a gene we call it APC, okay, adenomatous polyposis gene. هذا ال APC لما بصير له inactivation, the risk of polyp disease and neoplastic transformation is increased. طيب how many يعني what's the cumulative risk أو percentage؟ عندنا حوالي 1% من colorectal cancer cases هم because of APC. However, it is rare, but if it is there يعني إذا أنا باجي بعمل genotyping ولاقي إنه في عندي loss of function in activation of APC أو عندي الFAP mutation, the risk of that individual to develop colon cancer is very very high يعني تقريبا 100% risk بالthird decade أو بالfourth decade هيك شيء. okay, these patients will develop colorectal carcinoma. okay, the risk is very high, the incidence is very low, it's very rare, but the risk is very high. فهدول المرضى what should we do to them؟ يعني إذا إجا مريض وأنا لقيت إنه عنده FAP أو APC mutation, what should we do? Especially by young age, okay? لأن risk is very high. We usually do complete resection of the colon. يعني we remove the whole colon, okay? Just like we did لما بنلاقي BRCA mutations in the female patient حكينا we remove the breast tissue, we remove the ovaries because the risk is very high. Same thing here. So this is a preventive measure, okay? Because the risk is very high. هلا another important genetic factor associated, we call it the Lynch syndrome, okay, or the Lynch disease. This is also not very common, okay, it's rare. هذا مرتبط بautosomal dominant mutation. المشكلة هون هي بالDNA repair genes. We are losing the function of mismatch repair genes. The DNA repair genes are mechanism. We have families of enzymes. They are responsible for different types of DNA repair. Okay, لكن بشكل عام إذا في impairment to the DNA repair machinery, you know that every time the cell divides, في errors. Okay, it can happen. The DNA repair machinery or proteins or genes detect and correct these errors. Okay, so the genome is reserved. فما بيصير عندي changes or polymorphism or deletions or insertions بالجينوم fixed بتصير. Okay, فبالتالي إذا أنا the cell, the normal cell is unable to fix the genetic errors, these errors will stay, okay, will accumulate, وبالتالي the genome starts to change and the patient normal cells become neoplastic or transformed cancerous. ولما بيكون في عندي أنا genetic mutation loss of function of a group of DNA repair genes بنقولها mismatch repair. okay, لأنه DNA repair genes عندنا كتير أنواع منها البيز excision repair, homologous repair and so on. فهاي الجروب of genes mismatch repair genes لما بصير فيها genetic mutation, this can cause Lynch syndrome which is associated with colon carcinoma. فهذا كمان not very common بس الريسك بيكون very high. okay, هلا ال colon cancer, okay, as I said, the presence of polyps, okay, put the patient at high risk, and these polyps can transform and cause carcinoma. Okay, colon cancer might be in situ, as we discussed before, which means they do not invade through the layers of the colon. رح نحكي بالstaging, or they could be invasive. Okay, فبالتالي إذا إحنا عنا in situ colon carcinoma or invasive carcinoma, okay, stages 1 or 2 or 3, usually we have to remove that part of colon that contains the cancer. فإذا كان this is another polyp here if you can see. فإذا كان عندنا يعني الكانسر موجود in one segment of the colon, you just remove that part. ما في داعي أعمل complete removal of the entire colon or cancer. okay, or rectum عفوا. فبالتالي we remove surgically, we remove the part of the colon that contains the carcinoma, okay, as long as it's not diffused. هلا lifestyle factors, some of them increase the risk of colon cancer and others decrease, okay, the risk. هلا lifestyle in general, westernized lifestyle, which means diet that is high in fat and high in salt. Processed meat, يعني هاي اللحوم اللي بتكون very processed, okay. Usually it contains a lot of additives and preservatives that potentially harmful to the colon endothelium. فبالتالي هذا lifestyle is associated with increased risk of colon cancer. Smoking, alcohol intake كمان يعني strong risk factors, okay. Obesity is also a very important risk factor for colon cancer. These lifestyle factors increase the risk, but they are potentially modifiable, okay. فبالتالي if you eat healthy, you decrease salt intake and processed meat and fat intake. إذا كان البيشنت بياخد alcohol, stop alcohol, lose weight, you can decrease the risk of colon cancer. هلا في عنا certain drug therapies that were associated with reduced risk, but it is not evidence-based. يعني شو؟ يعني هاي معظمها observational studies, okay? فبالتالي لقيوا مثلا إنه using aspirin or cyclooxygenase inhibitors يعني incidence أو risk of colon cancer is reduced, okay? لكن هذا لا يعني إنه we use aspirin or celecoxib مثلا to reduce for chemo prevention, to ask patients to use them to reduce their risk لأنه ما عندنا evidence on this, okay? فالaspirin and NSAIDs associated with reduced risk, vitamin D and calcium, and hormone replacement therapy. You know, all these drugs, the use of these drugs was associated with a reduced risk, but none of them is approved for prevention or to reduce the risk of colon cancer, okay? We do not recommend them to reduce the risk of colon cancer so far, based on the current evidence. Right, هلا if we look at the layers of colon, okay, بناخذ cross section بنشوف بنلاقي إنه في عنا الepithelium, okay, and the mucosa. After that, we see the muscle layer, okay, submucosa, muscle, and then we have the serosa, the blood flow, we can see the supply. Then we have the lymph nodes surrounding, okay. هلا when we talk of the a proposed theory or mechanism how a normal colon epithelium becomes cancerous, becomes carcinoma, okay? What's happening? هلا في عنا different theories, but the most accepted model or theory, we call it adenoma carcinoma, okay? شو فرق الأدينوما عن الكارسينوما? Do you know the difference when we say adenoma? What is adenoma? شو يعني adenoma? How it is different from carcinoma? Do you know? حدا بيعرف what is adenoma? Yes, آية. آية صمادي، تفضلي. آية أنت ميوت. unmute yourself please.
benign.
Yes, good. فإحنا لما بنقول
مسموع صوتي؟ Yes,
adenoma.
carcinoma هي malignant.
Good, excellent, yes. فإذا إحنا لما we have adenoma, okay. إذا إحنا في عنا hyperproliferation, في عنا mass, في عنا polyp, okay. It is not still cancerous. بمعنى if I take biopsy of this adenoma here, okay, or this large adenoma here, the cells are still normal. They are not transformed. They do not become cancerous or malignant yet, okay. هلا the theory about colorectal cancer that a normal epithelium, okay, a normal epithelium becomes hyperproliferating, okay. There is a factor or a cause that could be genetic or non-genetic, environmental, whatever. في سبب, okay, that will drive a normal epithelium to hyperproliferate, okay, and develop these adenomas or polyps, okay. Now, after this first step of adenoma development, صار عندي adenoma, okay, there is another drive, there is another cause, okay, a genetic factor, a lifestyle factor interacting with a genetic factor, okay, that cause this hyperproliferating benign tissue, okay, to becomes now cancerous, to becomes malignant. ففي عنا process here, okay, in the development of eventually colon carcinoma. Now, when we have carcinoma, when it is malignant tissue now, okay, cancerous, it starts to acquire abnormal criteria and traits. Now it becomes invasive, it can migrate, it can get into blood vessels, and we start to stage carcinoma. It can be localized, and we end with metastatic disease or stage 4 disease. Okay, طيب, what are the factors, okay, in what drive? The important factors that can drive adenoma is the development of excessive oxygenase activity. وcyclooxygenase will inflammation. Inflammation, by the way, important aspect of cancer. يعني احنا بنحكي about cancer, we talk of inflammation is very important. فبالتالي
الصوت بأثر.
فبالتالي احنا في عنا factors known to drive this benign transformation or في عنا other factors that can cause actually the transformation into malignant disease. ففي عنا a lot of mutations رح نحكي عنها like KRAS, BRAF. هاي عبارة عن we call them small G proteins, okay. بنلاقي مثلا كتير من المرضى اللي عندهم colorectal cancer بنلاقي في overexpression of epidermal growth factor receptor, okay. يعني many patients, 75% of patients, their tumor, their cancer cells overexpress EGFR, and this is a growth factor receptor, and it normally activates these small G proteins. إذا إحنا في عنا in this process في عنا genetic factors involved with environmental factors that drive, you know, certain enzymes to increase their activity or overexpression of receptors and so on. Eventually, we have carcinoma. الcarcinoma هاي can metastasize. The most important sites of colon metastasis, colon cancer metastasis, and visceral involvement, liver and lung are very important sites. It can also metastasize to the brain, okay? If we detect abnormal secondary lesions on the liver, lung, or brain, this is directly a stage 4 disease. This is metastatic colorectal cancer, okay? طيب, هلا مثل ما حكينا when we talk of prevention, okay, patients with familial factors or causes who are at very high risk to develop the carcinoma, colon carcinoma, we need to do surgery, and usually we remove the entire colon, okay. هلا do we consider drug therapy اللي أنا حكيت عنهم for prevention? So far ما عندنا evidence, okay. فما عندنا drug therapy for prevention. يعني إذا بتتذكروا بالbreast cancer قلنا إنه sometimes in certain conditions you can consider tamoxifen, maybe raloxifene, okay, maybe aromatase inhibitors in postmenopausal women, though it's not FDA approved. في أدوية. So far in colon cancer we don't have an approved or a clear evidence to use certain drugs for prevention of carcinoma, okay. What we do, we need to screen for the disease. بمعنى إنه هدول المرضى especially إذا كانوا above average risk, okay, يعني في عنا average risk patients without يعني a clear risk factors, okay, وفي عنا above average risk أو high risk patients, those with risk factors. فبما إنه ما عنا بهدول two cases chemopreventive drug أو approach, we need to screen at certain times So screening help detection of the carcinoma, and so maybe interacting very fast to the treatment of the cancer very fast. When we talk of screening of colorectal carcinoma, we have many methods actually. In fact, many ways. الكولونوسكوبي هو الجولد ستاندرد. يعني you cannot actually replace colonoscopy with the sigmoidoscopy أو الأكلت blood test. يعني هذا الأساس colonoscopy هو الجولد ستاندرد and you can add to it other screening methods. Okay. طيب إحنا بالكولونوسكوبي يعني شو بنعمل؟ في حدا من الطلاب الموجودين، في حدا منكم عمل كولونوسكوبي قبل هيك؟ أو بتعرفوا حدا عمل كولونوسكوبي قبل هيك؟ في حدا بيعرف مريض colorectal carcinoma أو colon carcinoma؟ No؟ طيب الكولونوسكوبي هي يعني a procedure that might take like 10 minutes, 15 minutes, okay? As we said, complete bowel evacuation, okay? باستخدام colonoscope, okay? هذا الكولونوسكوب هو عبارة عن تيوب، okay? طبعاً يعني under observation of يعني imaging أو directed by imaging technique. The physician will insert the colonoscope and start to investigate the entire colon. Okay, يعني starting with rectum going up to the entire colon. Okay, investigating the wall. يعني بتطلع إنه هل في any abnormalities. Okay. Sometimes يعني the modern colonoscopes can actually even take direct biopsies. Okay, or directly remove polyps. Okay, يعني لنفترض مثلا إنه while the physician is checking لقى abnormal mass. Okay, now some colonoscopes can directly take sample or biopsy from that mass. هلا أحيانا مثلا كمان ممكن ينعمل polypectomy during colonoscopy. يعني مثلا لقى إنه في few sporadic polyps خلال الexamination، كان عددهم قليل البوليبس. Okay, resectable with the colonoscope, they can do polypectomy. They cut the polyp directly. Okay, مثلا لقى هون عنا abnormal growth، لقى في مثلا adhesions. فالcolonoscopy is very diagnostic, is a great method to check the entire colon, the rectum, find any abnormalities, sometimes even interfere with them directly. فالcolonoscopy هو الgold standard. Okay, you add to colonoscopy other methods like sigmoidoscopy, flexible sigmoidoscopy. Okay, computed tomography, الباريوم meals أو enema، الفيكال occult blood test. يعني الفيكال occult blood test هو to check or find hidden blood in stool. طبعا fecal means it's not obvious, not clear. Even if positive alone, it does not mean a lot. يعني ممكن يكون في GI bleeding not because of colon cancer. يعني ulcers can cause fecal occult blood test, diverticula can cause it. يعني هو مش كتير إشي specific. Okay, فبالتالي بيضل ال DNA screening test اللي هو we look at cancer DNA in the stool. They are useful but not without colonoscopy. فالcolonoscopy هو very important to screen or diagnose colorectal carcinoma. It's very important. هلا for average risk patients, not high risk patients, it's recommended that colonoscopy screening for colon cancer starts at age 50. Okay, if everything is fine, بينعاد every 10 years. Okay, patients at higher risk ما عم نحكي عن familial cause، عم نحكي عن high risk patient. يعني مثلا family history of the disease, مثلا diabetics، يعني many alcohol intake, many risk factors. هدول we might recommend screening at younger age. يعني ممكن 45 حتى أحيانا 40 years of old. Okay, we might recommend colonoscopy. مع الكولونوسكوبي ممكن ينعمل fecal occult blood test sigmoidoscopy. Okay, لكن بضل هذا الكولونوسكوبي alone might be actually enough. Okay, فscreening مهم to catch the disease early. هلا clinical presentation, if I ask you what do you think is the يعني مريض عنده already colon carcinoma, what do you think the most important clinical presentation would be? إيش بيجوا هدول المرضى عندهم in terms of symptoms and signs? What do you think? سنار?
ممكن internal
Yes, تفضلي.
internal bleeding.
bleeding. يعني أنا بشوف يعني شو بشوف المريض؟ شو الساين أو السيمتوم اللي بتيجي؟ إذا في bleeding وين رح يشوفه؟
blood in the feces ممكن.
Yes, excellent. But blood in stool is a very alarming sign. طيب هل ضروري كل مريض عنده gross blood؟ طبعا blood in stool gross visible يعني بيشوفوا المريض. Okay. طيب any patient with blood in stool, it means cancer. What do you think? Yes, عبد الرحمن.
نو دكتورة، لأنه في الانفلاماتوري بول ديزيز كمان بصير.
Yes, excellent. فإذا blood in stool هو alarming. يعني شو؟ يعني إذا المريض reported إنه في blood in the stool and visible blood in the stool, okay? We have to check, we must check to assure whether this is because of carcinoma or other causes. Do you know that hemorrhoids can cause visible blood in stool? يعني المرضى اللي عندهم hemorrhoids they commonly can see blood in stool. مثل ما قال زميلكم أحيانا الانفلاماتوري bowel disease ممكن يكون في blood in stool. diverticular ممكن تعمل blood in stool. إذا في GI bleeding مثلا مريض عنده cirrhosis وعنده varices صار معه مثلا rupture أو bleeding ممكن يشوف blood in stool. ف it is not definitely مش أي blood in stool means هذا المريض عنده colon cancer. لكن this is alarming. You could not ignore blood in stool, visible blood in stool. طيب, what else? What else يعني هيك complain ممكن يجي المريض إنه عنده you make us doubt إنه ممكن يكون هذا because of carcinoma. رانيا تفضلي.
ممكن
رانيا.
دكتور ممكن دكتور constipation أو nausea أو vomiting.
Yes, excellent. Do you know that most patients 25% يعني إحنا نقول تقريبا ربع الحالات and this is a big number, okay? Their only complaint is a sudden change in bowel habits. مثل ما قالت زميلتكم يعني بيكون المريض عنده normal bowel habits, okay? All of a sudden constipation, all of a sudden diarrhea, and it's persistent, okay? severe. يعني في كتير مرضى بيجونا إحنا يعني شفنا كتير cases بالمستشفى colon cancer. The complaint is diarrhea, okay? Or the complaint is constipation. هلا constipation and diarrhea هي عبارة عن يعني sign for an underlying issue. Many cases are treated symptomatically. يعني it is not unlikely. It's common scenario إنه يروح مريض على الفارماسيست ويقول له عندي diarrhea أو constipation, I need a laxative مثلا أو بدي أنا treatment antidiarrheal, and the pharmacist can dispense these drugs. Most of them are over the counter. هلا this is okay, لكن we need to ask يعني ما بكفي أعرف إن المريض عنده diarrhea أو constipation. I need to ask the time, how long. I need to ask about the circumstances. يعني that the diarrhea happened all of a sudden, كانت associated with مثلا a meal, ممكن تكون gastroenteritis, ممكن تكون associated with drug therapy. المريض أخذ antibiotics مثلا. Constipation, same thing. Many drugs cause constipation, so we have to inquire. But if we treat diarrhea or constipation symptomatically, and it is not because of carcinoma or a serious GI problem, المفروض إنه this diarrhea or constipation will resolve in few days, okay? Persistent diarrhea, persistent constipation or diarrhea with or constipation with blood. Okay, هاي بدها referral. يعني المريض هذا لازم يروح على الهوسبيتال. اوكي، خصوصا بالالدرلي بالجيرياتريكس. اوكي، يعني patient جايين عمره فوق ال60 وعم يحكي complaining of diarrhea most of the time not resolving or constipation, sudden changes in bowel habits, severe nausea and vomiting. مثل ما زميلتكم قالت I have seen one case colorectal carcinoma, the only complaint was يعني protracted persistent vomiting. كان المريض عنده ما كان يشكي من أي شيء ثاني، بس if he eats anything كان يصير معه vomiting. okay, فلما عملوا له upper and lower GI endoscopy colonoscopy and upper endoscopy لقيوا عنده sadly speaking كان عنده كانسر. okay, فبالتالي ال changes بالجي اي habits هي عادة بتكون ال most important symptom. ال blood in stool is very alarming. okay, يعني you cannot ignore blood in stool, and that's why by the way يعني it's very important that patients or individuals they inspect ال fecal material or even حتى اليورين. يعني before you flush the towel just inspect. يعني هل مثلا في blood، هل ال consistency أحيانا consistency of the fecal material tells a lot about the GI health and function. okay, أحيانا اليورين it could has its smell changed أو مثلا its color changed. فبالتالي it's not embarrassing، بالعكس it's a good practice, a healthy practice to inspect the fecal material because this can tell you about the GI function. فما عندنا very specific symptoms. هلا fatigue is common, anemia can happen because of the cancer. Could be because of bleeding or not. فبالتالي هذول المرضى ممكن يصير معهم anemia. okay, إذا كان في GI bleeding associated with the carcinoma we can see blood visible or occult. عشان هيك احنا بنعمل occult blood test or fecal blood test. okay, هلا sometimes if there is metastasis يعني إذا كان في already liver involvement بنلاقي abnormalities in hepatic function or liver enzymes. This we can see it. ممكن نلاقي enlargement in liver, hepatomegaly. okay, ممكن مثلا أحيانا نلاقي certain biomarkers رح نحكي عنهم elevated like carcinoembryonic antigen. This is very important in colon cancer. We'll talk about it. okay, فبالتالي إحنا ما عندنا very specific sign or symptom, but we have to put them together, especially in the elderly patient, and rule out. يعني إذا عندي signs or symptoms or presentation, it could one of the differential diagnosis. This is the first thing we have to rule out. okay, لأنه هاي symptoms ممكن تكون associated with other GI conditions. okay, ulcerative colitis ممكن تعمل هاي presentation change بالbowel habits, blood in stool. okay, Crohn's disease can do it, diverticular can do it. okay, فإحنا بالتالي بنعمل differential diagnosis. The most important thing to rule out okay هو الكارسينوما أو colon carcinoma. okay, carcinoembryonic antigen in most patients with colon cancer it is elevated، لكن إحنا ما بنعتبره diagnostic factor. يعني مو ضروري أي مريض carcinoembryonic antigen عنده إذا elevated معناها أكيد عنده colon cancer. We consider it more kind of prognostic. يعني هو بيجي elevated okay in most patients with colon cancer. Now with appropriate treatment and good response it start to decline. بينزل CEA. It could be a marker for maybe recurrence or relapse. طب رجع ارتفع all of a sudden might be something wrong, there is disease recurrence or relapse. فإحنا بنعتبره more predictive and prognostic marker than diagnostic. We do it بس إذا كان نورمال هذا لا يعني إنه المريض ما عنده colon carcinoma. في مرضى ممكن يكون عندهم colorectal carcinoma ويكون ال CEA normal. okay, but in most cases it's elevated. okay. طيب هلا staging of colon cancer. we use the same system, the TNM system اللي حكينا عنه بالبريست cancer. Actually هذا the most accepted system to most solid cancers. فإحنا في عنا invasive carcinoma, okay, starts to invade through the layers of the colon, invasive carcinoma, okay. This takes stages 1 to 4, okay. وفي عنا in situ carcinoma, okay, in which the tumor stays in the mucosa, does not invade to the subsequent or below layers. فهذا بنقول له in situ of stage O, okay. IS means in situ. فإحنا عنا stage O is in situ disease. There is no invasion, okay, to the submucosa or muscle. ما في. It is a malignant a tumor. يعني هو عبارة عن cancerous, but it's not invasive, okay. Usually in situ disease, the survival is very high, okay, and you can do surgery and remove the tumor, okay. هلا بهمنا إحنا invasive carcinoma, okay. invasive carcinoma stage 1 and stage 2 disease, okay. There is no lymph node involvement and there is no metastasis. هلا M value here same as breast. Either there is one disease or metastatic disease, or there is no metastasis, or so it's take M0 disease, okay. فبالتالي stage 1 and 2 there is no lymph node involvement, no metastatic disease. The tumor size is variable, okay, and it's expected to be larger in the stage 2 disease. فإذا إحنا لما بنطلع على stage 1 and 2, there is invasive carcinoma. The tumor starts to move down from the colon epithelium and mucosa layer to the submucosa and muscle. But in stage 1 and 2 disease, still the lymph nodes were not involved. The cancer cell did not reach lymph nodes, okay? هلا stage 3 disease we start to find or see lymph node involvement. فإذا lymph node involvement بشوفه stage 3 disease. فإذا stage 3 disease we start to have lymph node involvement, okay. The number of lymph node involvement is variable, and you can see small involvement, you can see larger involvement, but there is cancer cells in the lymph nodes, okay. فبالتالي هذا صار stage 3 disease. Now regardless of
دكتورة الصوت راح.
دكتورة في حدا حط ميوت للكل.
مين عمل لي ميوت؟ وبعدين بهالقصص يعني how many times أنا بنسى أعمل الكنترول لإلي لحالي. actually it's also my responsibility, but you are يعني أنتوا كبار يا جماعة، يعني شو هالقصص؟ يعني what's the benefit when you mute me? what's the point؟ اللي بده يعمل ميوت لإله you mute yourself, don't mute other people, okay؟ لو سمحتوا، وين آخر شيء سمعتوه؟ وين آخر شيء كان الصوت واضح؟ Do you hear me now?
دكتورة بس عند stage 3 بصير lymph node involvement يعني بس لهون.
اوكي إذا احنا حكينا لما بيصير عندنا lymph node involvement, okay, this is a stage 3 disease. تمام؟ هلا if regardless of T and N, if we do our checkup ولقينا إنه في secondary lesions in any of the organs of metastatic disease, distant طبعا metastatic disease, هذا directly stage 4, okay, directly stage 4. طيب هلا if you can look at the survival here, okay, what you can tell about survival in percentage. طبعا احنا نحكي about percentage of patient survival. شو اللي بيصير فيها as long as we go on with the stages from the in situ to the metastatic disease? شو اللي عم بيصير بالsurvival؟ بالpercentage of survival. Yes, Rania.
It will decrease.
Definitely. Okay. فهذا إيش معناه؟ هذا إيش معناه؟ The earlier we diagnose the disease in earlier stages, the better the survival and the better the outcomes. Okay. ال staging is important. We need to know for treatment to come with a plan. Okay. We must know the stage, the TNM stage of the colon cancer. Okay. فهاي one important information we have to keep in mind. هذا, if you can see here, this is an invasive colon carcinoma, and it actually is necrotizing. If you look at it, it has been removed already. فهذا يعني I think على الأقل stage 2. I don't know if it reached lymph nodes, بس واضح إنه highly infiltrating, removed with surgery. وطبعا إحنا دائما keep in mind when we remove the tumor mass, we remove a little bit of the regular tissue around, لأنه البوتنشال إنه it spread to the tissue surrounding هو high. فدائما you will see that the surgeon will cut or remove the mass itself. يعني ما بيقطعوا exactly around the mass. Okay. في عندنا margins, we call it surgical margins. Okay. طبعا after the resection, the tumor is sent along with the margins, sent to the pathology. They investigate the tumor cells and they investigate the margins, whether they are clean or actually contains tumor cells, and this is important. They also check lymph nodes, whether involved or not. Okay, they count the lymph node involvement, if any. And so a lot of work is done after surgery, and this is important. Okay. طيب. هلا we will start briefly about the treatment of colon cancer. هلا الكتاب is separating stages together, will stage 4 metastatic disease together. So we will follow the same style of the book. رح نحكي عن operable disease. لما نقول operable colon cancer احنا عم نحكي عن stages 1, 2 and 3. Metastatic stage 4, by definition, it could be, ممكن تكون resectable tumors in stage 4, potentially resectable or unresectable. فأنا ما بدي إياكم to confuse it. فلما بحكي أنا لا إنه the tumor might not be, it could be. يعني بالcolon cancer, بالmetastatic disease يعني resectability. Okay. لكن المانجمنت للدراج ثيرابي يعني في أدوية classes of drugs only in metastatic disease, so we put it like in a separate part. Okay. ففي عنا straightforward operable disease اللي هو بيكون مريض جاي 3. This is directly resectable. Okay. And is potentially always resectable. Metastatic disease, sometimes we do surgery to the colon, the cancer in colon. Okay. هلا بالاوperable disease stage 1. Okay. Stage 1, we go with surgery. يعني the first step forward, we do surgery. Okay. هلا in more than 90% of patients, surgery is curable. شو يعني? I do surgery, I don't follow it with systemic chemotherapy. يعني ما بعطي in most cases, okay, من stage 1 disease, okay, surgery alone is enough. فبالتالي if surgery is curable, why? If you recall the staging, احنا بنحكي بstage 1, the tumor did not reach lymph nodes. Okay, compared to stage 2, they are smaller tumors. They are not that invasive. Okay, فبالتالي surgery alone isn't enough. فما بعطي routinely. Okay, adjuvant chemotherapy, systemic chemotherapy after surgery is not indicated in most cases. Okay, من stage 1 disease. هلا stage 3 disease, اوكي اللي هو حكينا هاي عبارة عن tumors highly invasive and associated with positive lymph nodes or lymph node involvement. Okay? In stage 3 disease, we always do or give adjuvant chemotherapy. Stage 3, we do the surgery, we remove the colon cancer. After a couple weeks, few weeks, directly proceed with adjuvant chemotherapy. Okay? ليش احنا بستيج 3 لازم نعطي adjuvant chemotherapy؟ ليه بستيج 3 we have to do it? Why do you think we must do it? مين بيقول؟ حدا بيعرف؟ طيب if I ask you about risk of recurrence أو relapse, do you think إنه رح يكون أعلى بstage 1, 2 أو stage 3? The potential that the disease will come again after يعني recovery after cure. لأنه إحنا بstage 1, 2 and 3 the goal is to cure. The patient can be cured. Okay? طيب إذا حكينا about the risk of recurrence or relapse after the cure رح يكون أعلى بأي stage؟ Yes, Aya?
بستيج 3.
Good, in stage 3. Why you think the relapse rate أو recurrence rate بstage 3 أعلى؟
maybe لأنه هو أساسا بيكون aggressive أكتر من الستيجز اللي قبله. ممكن يكون invasive أكتر واحتمالية السبريد تكون أعلى كمان.
طيب شو الإشي اللي بيميز stage 3 اللي associated with a higher risk of relapse؟
maybe إنه invasive.
All stages are invasive. هلا إحنا لما بنقول stage 1 it's invasive, right? Stage 2 invasive. بس stage 3 ليش risk of relapse أو recurrence أعلى بstage 3؟ رانيا yes
لأنه يمكن يوصل للليمف نود.
لأنه واصل للليمف نود already. Yes, good. هو مش يمكن هو already there. لما إحنا بنحكي stage 3 colon cancer مش هذا معناه إنه في lymph node involvement؟ إنه already واصل الكانسر cells على الليمف نود. This makes the potential of recurrence or relapse very high compared at least to stage 1 or 2. These two stages ما فيها lymph node involvement. فبالتالي to secure the patient condition نتأكد إنه we minimize the chances for relapse and recurrence, we always, it's a standard, it's routine إنه مريض جاي TNM stage 3 colon cancer نعطيه بعد surgery and recovery of surgery healing directly we proceed with the adjuvant chemotherapy. طيب هلا الجراي area that we ask the question whether we need adjuvant chemotherapy or not هي stage 2. هاي بنعتبرها a little bit controversial. شو يعني؟ Do we need بهذا المريض نعطيه adjuvant chemo or not? طيب انتوا برأيكم مريض stage 2 which means an invasive carcinoma, okay, but it did not reach the lymph node. برأيكم هذا المريض إمتى we have to consider إنه ينعطى adjuvant chemotherapy وإمتى إنه okay hold we don't need to go with chemotherapy؟ إمتى برأيكم لازم هذا المريض ياخد adjuvant systemic chemotherapy وإمتى لا؟ stage 2 disease لأن إحنا بنحكي stage 3 it's not a negotiable, it's something standard. We must give chemo. Stage 1 we do not give chemo. But stage 2 إمتى we recommend adjuvant chemotherapy to this patient؟ برأيكم إمتى؟ Yes, سنار.
ممكن اللي بيكونوا high risk for relapse إنه بيرجع لهم مرة تانية بنعطيهم.
Excellent. طب مين هذا المريض اللي عنده risk of relapse stage 2 ممكن يكون عالي؟ رانيا؟
دكتورة ممكن يكونوا اللي poorly differentiated tumor.
Excellent. Good. شو يعني poorly differentiated tumors? If you want to translate into another term, هاي التيومرز ايش بيكون مالها لما بتكون poorly differentiated؟ احنا حكينا العلاقة بين ال differentiation وال proliferation, right؟ زي قالت poorly differentiated tumors. طيب هاي ايش يعني؟ احنا مش حكينا انه بعد السيرجري راح يروح لتيومر على الباثولوجي، راح يعملوا تشيك على الكانسر سيلز وعلى التيومر و طيب الكلمة اللي قالتها زي ما تكون poorly differentiated tumors، يعني هاي الجريد تبعها ماله، البروليفريشن تبعها ماله، هاي التيومرز. مش احنا شرحنا علاقة الجريد بالبروليفريشن بالديفرنشيشن؟ شو علاقة هدول الثلاثة مع بعض بالسوليد كانسرز؟ حتى حكيناها I think بالليمفوما، الفوليكولار ليمفوما، لما بيكون التيومر يعني highly proliferating كيف بيكون الجريد تبعه يا سرانيا؟
دكتورة بكون كثير يعني بكون عالي الجريد اللي له.
high grade, right? Good. فإذا high proliferation rate means high grade tumor. طب والhigh grade tumor إيش بتتميز يعني هاي؟ in term of prognostics، مش حكينا إحنا بالprognostics بالبريست كانسر لما الجريد يكون high grade high proliferating tumors and poorly differentiating، هذا something good or bad in term of prognosis and relapse and recurrence? Good or bad? Yes, Aya. Aya. Aya, unmute yourself. Into mute. It's very bad. صح. إحنا حكينا إنه high grade means high proliferating tumors and poorly differentiating. فبالتالي هاي tumors very aggressive tumors، فالريسك of recurrence or relapse معها بيكون أعلى. طب إذا أنا عملت تشيك على التيومر ولقيت إنه high grade highly proliferating very poorly differentiating، يفضل بهذا المريض in stage 2 إني شو أعطيه؟ systemic chemotherapy, right? طيب فإذا poorly differentiating or highly proliferating tumors of high grade، مثل ما قالت زميلتكم ال highly invasive tumors كمان كل ما كان more invasive this is important to consider chemotherapy. طيب لنفترض إنه أنا لما بعثت التيومر على الباثولوجي الباثولوجيست could not isolate sufficient number of lymph nodes ويعمل عليها تشيك إذا واصلها cancer cells أو لا. في شيء بنقول له inadequate lymph node pool، يعني ما قدر يعني isolation of lymph nodes is really challenging، صعب كتير، فما قدر يعني يطلع بس 2 أو 3 lymph nodes من التيومر من الكولون، وما قدر يتأكد إنه هدول يعني ما قدر يطلع lymph nodes ثانيين ويعمل عليهم تشيك، يعني inadequate lymph node sampling or pool. شو رأيكم؟ We could not rule out lymph node involvement. We could not confirm lymph node involvement in stage 2 disease. هذا eligible إنه ياخذ المريض systemic chemotherapy or not؟ شو رأيكم؟ Yes, مرح. مرح, yes. تفضلي. I can't hear you. طيب لما بيكون inadequate lymph node sample أو pool، الأدعى الأفضل إني أعطي كيموثيرابي. أوكي؟ فبالتالي بstage 2 أوكي in certain conditions high grade tumors very poorly differentiating cancer cells lymph node pool أو sample was not enough. إذا في عندي other symptoms like perforation of the bowel T4 lesions. T4 lesion معناها إنه the tumor is reaching the skin actually. Okay. فبالتالي these causes here or these factors here implies really something bad. Okay. فبالتالي stage 2 الروutine إنه maybe not recommended in surgery enough, but if we have any of these factors, it is recommended to consider adjuvant chemotherapy after surgery. Okay. فعشان هيك احنا بنحكي شوي gray area whether to decide to go to chemotherapy adjuvant or not. طيب how about radiation therapy؟ يعني احنا حكينا انه surgery is mainstay in colon cancer. We do surgery in the operable disease, and then in certain cases and in stage 3 we must do chemotherapy adjuvant. طيب how about radiation therapy؟ بالcolon cancer it has a very limited role. يعني unlikely, very uncommon to consider radiation, which is different from rectal cancer. Okay? But rectal tumor, radiation is a mainstay. It's very important, but not in colon cancer. فبالتالي ما في عندنا role for radiation therapy in colon cancer. What we do in colon cancer? We do surgery and طيب. هلا الادجuvant chemotherapy شو البروتوكولز اللي بنعطيها؟ بالcolon cancer fluoropyrimidines اوكي اللي هم ال5-FU fluorouracil and capecitabine هدول الدوايين هم fluoropyrimidines اوكي فالفلوروبيراميدين based regimens يعني تكون regimen containing either 5-FU or capecitabine واحد منهم اوكي هم الcornerstone drug therapy أو skeleton and we add to them okay we add to them فبالتالي fluoropyrimidines هم cornerstone. When we add to them to either 5-FU or capecitabine, when we add to them oxaliplatin, this is called a triple drug regimen and وهي عبارة عن gold standard regimen in adjuvant stage 3 على الأقل colon cancer. فإذا إضافة الأوكزاليبلاتين على الفلوروبيراميدينز highly improves the outcomes, the response to therapy, and the cure rate. طيب, can we replace oxaliplatin with another? Oxaliplatin belongs to what family? حدا بيعرف شو الكلاس تبع oxaliplatin؟ هو عبارة عن شو؟ Yes, عبد الرحمن.
Alkylating agents.
Yes, بس which class بالضبط؟
Platinum containing agents.
Yes, platinum derivatives. وإحنا شو بنعتبره third generation platinum derivative أو platinum drug. Okay? طيب, can we replace oxaliplatin with cisplatin or carboplatin for example? يعني بصير أنا أعطي 5-FU مع cisplatin أو مع carboplatin أو capecitabine مع cisplatin أو carboplatin? It is not replaceable. Okay, بمعنى you use only oxaliplatin. Okay, ما بغيره to another platinum derivative. فإذا أنا عندي fluoropyrimidine plus oxaliplatin. Okay. طيب, if I used 5-FU alone or capecitabine alone, is this okay? Is this approved in colon cancer? If I did not add oxaliplatin to the adjuvant chemotherapy, and I only decided to go with capecitabine أو 5-FU بالadjuvant treatment, these are approved alone or not? حدا بيعرف؟ No, actually, yes, Sanar.
Yes دكتورة بس single agent ممكن نعطيك combination.
Yes, excellent. And you can give fluoropyrimidines alone, but this is only in case oxaliplatin is contraindicated or cannot be tolerated. بمعنى إذا إجا مريض stage 3 colon cancer ما عنده any issue to hold or preclude إنه أنا ما أعطيه oxaliplatin, okay? وأعطيته only الفلوروبيراميدين, your treatment is inappropriate, is not optimal. Why? Because the response rate for this regimen is less than when oxaliplatin is added to the fluoropyrimidines. Okay? فبالتالي always consider oxaliplatin in combination, okay, with fluoropyrimidines, either 5-FU or capecitabine, unless there is a contraindication or toxicity that cannot be tolerated. يعني أنا ضفت للمريض oxaliplatin after a couple of cycles صار معه severe neurotoxicity أو eat endo hypersensitivity could not be managed with drug therapy or tolerated, I can drop out oxaliplatin. Otherwise, if the drug is tolerated, okay, you always add oxaliplatin to the fluoropyrimidines. فهذا هو the standard protocol. طيب, something special about 5-FU. When we give 5-FU, it's recommended to give leucovorin. حدا بيعرف شو هو اللوكوفيرين؟ شو هو اللوكوفيرين؟ ما رح رافع ايدك؟ طيب اللوكوفيرين هو الفولينيك أسيد. شو هو الفولينيك أسيد؟ حدا بيعرف؟ طب شو الفرق بين الفوليك أسيد والفولينيك أسيد؟ طيب ال 5-FU ايش الفارماكوداينامكس تبعته؟ 5-fluorouracil. How it produces its anti-cancer activity. شو التارجت؟ طيب لل 5-FU. يس لينا.
دكتورة الفوليك أسيد.
الفوليك أسيد هو التارجت؟
هو أنتي ميتابولايت أو
Yes, 5-FU is anti-metabolite. Good. كيف يعني شو بيربط مع شو لحتى يصير عندي هذا الإفكت؟ شو التارجت تبعه؟ دانا؟
دكتورة أنا مو متأكدة بالضبط بإيش بيربط، بس هو بيعمل
أوكي.
فوليك أسيد ديفيشنسي، فاللوكوفيرين بتريد هاي السايد إفكت.
No, Dana, no. The 5-FU does not cause a folate deficiency. No, that's methotrexate. Okay, لأنه anti-folate. لا. سلسبيل. Yes.
دكتور بيشتغل على
بيشتغل على انزيم شو اسمه؟
thymidylate synthase.
Excellent. يعني target لل 5-FU is an enzyme called thymidylate synthase enzyme. So 5-FU binds that enzyme in the cancer cell, inhibit that enzyme, وبالتالي the DNA synthesis is impaired, is blocked. Okay? وبالتالي ال S phase is blocked. You cannot actually replicate DNA. فهو عبارة عن anti-metabolite drug. طيب, why it is always recommended, okay? We have to add leucovorin أو reduced folates. اللوكوفيرين هو عبارة عن reduced folate. Okay? Why we have to add leucovorin when we treat patients using 5-FU? لينا؟
دكتور ممكن عشان نمنع يصير توكسيسيتي إنه بما إنه هو عبارة عن أنتيدوت.
لا يا لينا، احنا حكينا انه ال 5-FU does not affect الفوليك acid level. اوكي، هو مش anti folate. No. يعني احنا ما بنحطها هون to rescue the toxicity. It's different from methotrexate and pemetrexate الانتي فوليتس. لا، احنا هون بنعطيه in combination for a reason اللي هو شو؟ سنار.
هو بيزيد البايندينج للدواء على الثايميديلين سينثيز.
Excellent, very good. تمام. يعني احنا هون لما بنعطي اللوكوفرين، اوكي، لما بنعطيه او هو عبارة عن reduced folate، اوكي، we should consider it. يعني هلا رح تشوفوا بالريجيمن، maybe we are running out of time next time ان شاء الله، رح تشوفوا بالريجيمنز اي ريجيمن فيها 5-FU مع لوكوفرين بالريجيمن او الفولينيك اسيد. اوكي. Why? As your colleague said, احنا لما بنعطي أو بيكون inside the cell في reduced folate accumulating inside the cell, the binding of 5-FU to its target, thymidine late synthase, is highly enhanced. The affinity is highly enhanced, so we get a better anti-cancer activity. طيب, in this regard, okay, نفترض أنا عندي regimen رح تكون عبارة عن 5-FU مع اللوكوفورين مع الأوكزاليبلاتين. هاي الستاندرد regimen, okay, اللي بنقولها فولفوكس، رح نحكي عنها next time. طيب, إحنا حكينا بدنا نعطي 5-FU، بدنا نعطي معه اللوكوفورين. طيب, where do you think we should consider leucovorin in the regimen? Before 5-FU administration or after 5-FU administration? إمتى لازم نعطيه بالريجيمن؟ سنار، رافعة إيدك؟ لا.
لا دكتورة غلط.
It's okay. طيب, بما إنه أنا لازم يكون عندي enough level of reduced folate inside the cell to enhance the binding of 5-FU to the thymidine late synthase. Then should I give leucovorin before I start 5-FU therapy or after I start 5-FU therapy? Yes, Nadine.
ممكن دكتورة before عشان إحنا نحسن البايندينج.
Yes, very good. It must be before. Okay. فأنا بالتالي بعطي اللوكوفورين بعطيه before my 5-FU treatment. So the cancer cell is prepared and it contains a good level of reduced folate before actually 5-FU is given. فلما بيروح ال 5-FU على الكانسر cell بيكون already عندي good amount of reduced folate and so the binding is enhanced. فمكانه بالريجيمن وين؟ قبل ال 5-FU. قبل ال 5-FU. تمام؟ المرة الجاية إن شاء الله بنحكي in details about the regimens. I will download ال attendance list. ما حدا يطلع لو سمحتوا. Okay. سنار.
يس دكتورة.
الايكون اللي حاططيه is very cute. Very cute little young girl. يعني هاي شو هاي؟ Okay, we are done. Thank you. We are done. هاي إيش؟ Disney character أو what's that?